Mesh-reinforced pancreaticoduodenectomy lowers the risk of post-operative pancreatic fistula. Pancreaticoduodenectomy is one of the complex and commonly used surgical option for treating pancreatic cancer and other lesions located at the periampullary region. But pancreaticoduodenectomy has high rates of post-surgical complications. Mesh-reinforced pancreaticoduodenectomy was introduced to minimize the risk of post-operative complications associated with pancreaticoduodenectomy. Some studies showed that there was no leakage after mesh-reinforced pancreatojejunostomy, and the incidence of biliary fistula decreased after mesh-reinforced pancreatogastrostomy. The aim of the study was to determine and compare the efficacy and safety of mesh-reinforced pancreatojejunostomy and mesh-reinforced pancreatogastrostomy in reducing post-operative complications. Patients with malignant or non-malignant disease scheduled for pancreaticoduodenectomy were included in the study. The retrospective observational study included 110 patients, of which 51 patients underwent mesh-reinforced pancreatogastrostomy, and 59 patients underwent mesh-reinforced pancreatojejunostomy. The primary outcome of the study was the development of pancreatic fistula after surgery. Other outcomes included post-operative stay, biliary fistula, abdominal bleeding, intra-abdominal fluid collection, delayed gastric emptying, and reoperations. Overall, the percentage of patients experiencing post-operative complications was higher in the mesh-reinforced pancreatojejunostomy group than the mesh-reinforced pancreatogastrostomy group. The mean comprehensive complication index was significantly less in the mesh-reinforced pancreatogastrostomy group than the mesh-reinforced pancreatojejunostomy group. The incidence of pancreatic fistula and biliary fistula was significantly less in patients who underwent mesh-reinforced pancreatogastrostomy than in patients who underwent mesh-reinforced pancreatojejunostomy. Intra-abdominal fluid collection and delayed gastric emptying were significantly reduced in mesh-reinforced pancreatogastrostomy compared to pancreatojejunostomy. The study results show that mesh-reinforced pancreaticoduodenectomy was safe and effective in reducing the post-operative pancreatic fistula. Also, mesh-reinforced pancreatogastrostomy emerged as a better technique than mesh-reinforced pancreatojejunostomy.